I'm fine. How are you too?
By the grace, I'm doing well. Now, so you raised some questions about some gaps in our preparedness process. Now, have those gaps been addressed subsequently by some of the measures that we are hearing?
Yeah, good morning to your listeners and viewers if you are streaming on Facebook. And I think at this point in time, we have tried to focus more on the educating people on their knowledge, attitude, and practices so that we can minimize the horizontal infections. But nonetheless, we still have to continue to make our point about what we told government since February and what has happened so far. The issues are still relevant. What we were telling government was that government was not prepared. And there were 4 reasons why we were saying government was not prepared. We don't want to move into that area, but now there are 2 critical points we need to consider now. The 2 issues are our border control. That's how I keep on saying our border control is not only in Accra. The border control, we have more than 55 districts in Ghana who are sharing borders with other countries. How are we strengthening this area? They are so very important. Very few area has been, and the authorities are painting the picture as if all is well in this border area. It is still not well. The other point is the safety, the occupational safety and hazards of health workers and other allied health advocates. Somebody like me, over the last 3 weeks, I have been touring across the country trying to find out what is happening there. So I'm exposed. I'm also exposed to, if I'm talking about poor safety protective measures, I'm not talking about only Ghana Health Service workers. I'm talking about anybody, including you, the journalists who are investigating, who try to find out where information is, alleged information or suspected cases, and you do not have the necessary logistics. That is an exposure. It's a serious exposure. So all that we are saying is that government has to deploy the DPEs to all the districts. There's no doubt about it. What we have are very inadequate. In some places, they can't even tell you they have more than 5 DPEs. As of yesterday, I tried to call not less than 10 districts I'm already working. My NGO work in this. And I know the frustration the district health directors are going through. So we are telling government that all is not well on the ground. Should we have more than 2 regions spreading the virus now, it's going to be dangerous. It is going to be dangerous. Even within the 2 regions that we have imported cases, and now we have vertical horizontal infection and reinfection. The information we are seeing now is not palatable. Nigeria recorded cases before us. Cote d'Ivoire recorded cases before us. But look at their infection rate, their total figure. Ghana has overtaken these 2 countries. But they recorded, in fact, 2 weeks ahead of Ghana's cases. What are they doing there that they are able to manage it? And what are we doing that we are escalating? So I want to put it on record again, as I've done on your platform a month ago, that there are no enough logistics for the Ghana Health Service staff. There are no logistics for we, the general public, who may go to the facility to seek for services.
I want to.
There are no adequate logistics for the Noguchi and the Kwame Nkrumah University of Science and Technology or the research center there. There are no adequate logistics.
I want you to separate the three for me. You're talking about three different groups of people. You're talking about the frontline medical personnel. You're talking about those who are doing the testing. And then you're talking about the average Ghanaian. Now, when it comes to the frontline, the hospital workers, the nurses, the doctors, among others, you're saying they do not have the logistics they need. When you say logistics, what are you talking about? For them.
I want to restrain myself from the laboratory people and talk about the normal frontline health worker. Two things happen when you suspect and you move to the health facility. There must be somebody who may have a distance between you and the person to ask you some basic questions, find out from your temperature. And if your temperature is within the normal, then you could move. But if you are suspected, you must be talking to another person. And that person you are talking about, by my public health practice, supposed to talk to two people. The one that is originally officially trained to support this COVID-19, and then a psychologist or a psychiatrist. Try to find out whether we have these two people adequately resourced. So the equipment for this frontline people, before even the samples are taken to the laboratory, are not adequately supported. Now, the person who is taking the sample, if you are suspected, and that value chain to, I don't want to talk about it, Noguchi will give you their practical experience. And remember when we had a talk with you, I think I engaged with the Director General of Ghana Health Service. I was saying that the approach is not engaging all, and the equipment are not enough. He claimed that there were enough equipment. So now that we have it and it's escalated, where are the equipment? So we can't play this role of trying to steal the reality. The accounts have the program they say, if you don't tell people about what you are going through, how will you get the help? And look, I'm doing a research. Let me give you a typical example. From 6 March till now, when the president opened up and became an advocate and appealed to Ghanaians, have you realized how the private sector is supporting government? So why were they quiet from January? Why were they quiet from January? When the donation from Steve General has only warned the whole world that any government who thinks that their state is a lie, is joking. In fact, that's the word, is joking. It is a global public health, it is a pandemic. And they will say, so today we find ourselves that today is a prayer day and fasting. I'm actually fasting and praying. And we will integrate our faith with technicality. And then see that God will sail us through.
Very, very, very necessary. If I get you right, you're saying that the government must also mix its preparedness with also talking about where it is struggling. Let people know that perhaps maybe if you acted a little late in the day, and now because several of the suppliers are closed now, you're unable to get the PPEs you need, you're unable to get the number of test kits you're looking for, you're unable to, you don't have the logistics you need. Let the public know, so those who are in the position to help, even if it's those who are outside, they are able to help. Is that what you are asking for? That they should also be speaking about the shortages, not only talking to us about what they are doing.
Exactly. If you notice all my statements I made February and March, early March, before the 8th March, all I was talking about is government speak out, get the private sector, get them involved. They waited until when we started recording cases before they started dealing with the private sector, the pharmaceutical and the other industry. So it tells you how unprepared we were, even though we were superficially showing to the world that we are prepared. We had a 2.5 or 2.8 million Ghana cedis. Some people had predicted we needed about 35 million, and then later on the president made a promise of $100 million. So where are all this money?
And
so all that we are saying is that all is not well with us. Nobody should pretend, and nobody should think that it is a statement that is causing fear and panic. It is rather an advocacy that should draw the attention of their responsibility. And they have the responsibility to bring all businesses in Ghana to contribute to this pandemic. No doubt about it. Other people are already doing it. I'm taking this opportunity to also tell all the MPs, they have the responsibility in their constituencies. This is the time to show their love to the people who voted them into power. They should not sit there and fold their arms and think that government should handle everything. They have a serious responsibility. In fact, I would want to see an MP that says that the whole of March I will not take my salary. I'm donating this salary to a campaign in my constituency. And let me give you my brother. My university just initiated a small campaign and a small support to 3 districts in the north. My brother, yesterday I received a call from one of the health directors telling me that she was even sharing tears for what I have done. This is me, small organization. My NGO and the university I managed supported some districts with just some small amount. In fact, the amount is not up to 5,000, but is able to give them some medical buckets, some sanitizer, and also to provide them some airtime with some radio stations, them to have time to talk and educate the public. And this amount is life-changing. So I ask myself, why are people still certain responsibilities? So integrated approach is the order of the day now. You and I, what we are doing is very helpful. We are drawing the policymakers' attention. It is not causing fear and panic. I want to put it to them that they have to stop that and do the right thing. And the right thing to do is that get the equipment to the district, protect the frontline health workers, let them discharge their duties should they have any suspected case without fear and panic among themselves. And you will see that a lot of professionals in the health sector are talking now. I would notice over the last 3 days that professors, doctors, nurses, midwives, and the various associations are talking now. Just do your check and see how people are, these associations are beginning to talk.
They are opening up a lot more. They are opening up a lot more. But Doc, I wanted to.
So they have seen they have seen the danger coming. So government should not pretend. The Minister of Health should not pretend. The Minister of Finance, more especially, should stop that and release the money. That's all.
You talk about releasing the money, and that's a critical issue here, because if we had the preparedness plans of 35 million Ghana cedis, that's about $7 million. Now, that has been scaled up to about $100 million that the president said he's asked the finance minister to make available. Why then are we having shortfalls and shortages in what do you call it, in the supplies of logistics for this fight?
Yeah, I'd had an opportunity to talk to one of your sister radio stations, and I was appealing to the Parliamentary Select Committee, and I was appealing to both the minority and the majority. After the money, you and I should not question whether it's big, too big, or small. But all that we need is that let the money be released. Let's use it to manage the crisis. after that, we will hold people accountable for how they have spent the money. That is not our matter now. Our focus is that Ministry of Finance begin to finance the program, and in fact, when we have a disaster, the virus do not know the Ministry of Finance and do not know your station, me and you talking. In fact, over the last 1 week, I've been indoors, and I know how much I'm losing. I'm doing research now. I have over 88 NGOs who have responded to the research now, and very soon we will publish what is happening in Ghana. The anxiety level, the productivity that is going down, which is also affecting our economy. And that is the interest of the Ministry of Finance. If they think that what we are doing is helping Ghana, it's rather creating more problems for Ghana economically. Because people are stressed out, people are restricted, businesses are going down, and therefore where will we get the taxes to support your development agenda? So it's a matter of we dealing with the matter once and for all, reduce and control the curve to begin to go down, and therefore confidence will come back to the system, and people will contribute their part to the economy. That is the relationship between health and economics. And the Minister of Finance should see this as an urgent thing. In fact, they should not spend any other money than releasing money for COVID-19. So that when we are able to push the curve down for the horizontal and community infection, we will begin to build confidence again for the economy to begin to boom. Even internally, if we are able to generate confidence within ourselves, our pharmaceutical industry and other private sectors can begin to produce made in Ghana goods, even if we decide to close our system. We can redistribute these goods and services within Ghana. That can really increase private sector businesses more and more and create more jobs than what we have experienced before. So the COVID-19 have direct relationship with our economic impact as well as the health impact. And every person at the Ministry of Finance should fear that they have a responsibility, whichever means they can pass to release money to the Ministry of Health and Ghana Health Service for them to play their role they are playing now.
Well, look, before I let you go, one last issue, because this is the talking point now. The Ghana Medical Association has said it is inevitable. We've heard the head of Noguchi also say we may have to. Now, today we are hearing the Socialist Forum of Ghana and the Trades Union Congress calling for a lockdown. Are we there yet?
Yeah, we are there. We're even delayed.
We have delayed?
We have delayed.
Can we afford to?
You see, we can't pretend. From February, if you had played a very critical role in managing our borders well, the first 2 cases we recorded, which we have prevented it.
So,
scientifically, there's enough evidence that if government has taken it serious in February, we could have prevented and, in fact, quarantined these first 2 cases before they were in the country or before they were in the region. We could have prevented this happening.
But at this point, you think we've gotten to the point of a lockdown?
That's the only way to be able to effectively trace. Otherwise, when we begin to record cases in the Bernakuu, in the north, we are doomed, because the people in the Bernakuu are related to the people in the north, and the people in the north are related to the people in Burkina, Cote d'Ivoire, and Togo. So when you have that spider web co-infection and reinfection, my brother, today is a prayerful day. Let's pray for God's intervention.
And of course, we will